Hello, everyone. Hello, innovators in the room. Good morning, good afternoon, good evening, wherever you may be. I am incredibly excited, as you can see, to welcome you to today's event, the brand relaunch of the VC Health Tech Hub, one of Africa's leading initiatives for capacity development of digital health professionals. When you think about a strong brand, think about any strong brand that comes to mind. You see a promise. When you think about a strong brand like the VC Health Tech Hub, you see a promise, or you should see a promise to build the digital health infrastructure and ecosystem of Africa. Today's event indeed signifies our renewed commitment to that vision, to that promise. So, indeed, I welcome you officially to the brand relaunch and promise renewal of the VC Health Tech Hub. Thank you so much for joining us on this auspicious occasion. I am Taiwo Olawemi. I'm a pharmacist and event host of over 6 years emceeing and moderating high-level corporate events. And I have the distinguished honor to MC today's event. I'd love to meet you too. I know we've got a lot of healthcare innovators, healthcare professionals, and digital health enthusiasts in the room. This room indeed is brimming with digital health energy, right? So I'd love to meet you. Tell us in the chats your name, what you do, where you're listening to us from. We really, really, really would love to know those who are in the room with us. So I like to read in the chats those of us who have introduced ourselves. So please introduce yourself in the chats, your name, where you're listening to us from, what you do. It's also an opportunity to connect with one another as we work together towards building the giant healthcare, health tech ecosystem, an effective interconnected one that we so desire across Africa. So I like to read in the chat. Abimbola Adebakin, founder, Advantage Health Africa, joining from Lagos, Nigeria. Yes, yes, yes. So lovely to have you here with us, ma'am. It'd be good to have more people introduce themselves in the chats. Keep the introduction coming. We want to read from you. Natarinda Emma, medical laboratory scientist and graduate student in health informatics at the University of Toronto, joining us from Canada. So lovely to have you here with us. Emma Ezine from Nova Scotia, Canada, pharmacist and clinical informaticist. All right, okay. So good to have you all here. Let's have more people introduce themselves. More people introduce themselves. And as people introduce themselves, you better take a step towards networking with them. LinkedIn has made the world indeed very easily accessible at the tip of your fingers. So please connect with the trailblazing healthcare innovators we've got across Africa and the emerging leaders that we've got right in this room. Blessing Wisdom, pharmacy student, mobile application engineer from Calabar, Nigeria. Roslyn Akonde, pharmacist, product designer, joining us all the way from the United Kingdom. So good to have you here with us, Roslyn. Dr. Tuwelika Nafuka, social justice activist and digital health transformation advocate for Windhoek, Namibia. So good, so good, so good to have you here with us. Please let's keep the introduction coming. Let's keep the introduction coming. We'd love to read from you, hear from you, and know those who are right here with us in the room. All right, ladies, gentlemen, healthcare innovators, you do know that Africa's digital health ecosystem continues to soar. And it's powered by our passion, our innovation, our continued and collective brilliance as a people. But that's not enough. That's not enough because despite the countless groundbreaking ideas that we've got across Africa, a lot of digital health solutions remain trapped in silos, unable to achieve their fullest potential. That's the challenge. And indeed, the opportunity. So when you begin to think of this, how do you think we can begin to move from isolated efforts to integrated systems that truly, truly transform the healthcare of our people? How do you think we can harness collaboration to convert our innovative concepts into long-lasting, life-changing, sustainable impact? How do we ensure that our shared vision for a truly, truly resilient, digitally enabled and empowered Africa not only reshapes pilot projects, but indeed impacts the entire population? And that's what we are gathered here to do. Today, we are gathered to rewrite the narrative of healthcare and digital health in Africa, shifting from isolated silos to interconnected, integrated systems that truly transform lives. That's why today's theme is from silos to systems, building skills to expand digital health beyond pilots. We've got a very distinguished keynote speaker and brilliant panelists who will drive the conversation as we move closer to that future where healthcare across Africa takes center stage, where collaboration indeed meets innovation. So if you're ready for today's session, please type ready in the chat. I want to read your readiness. I want to read your readiness. I want to read your readiness. Type in the chats for me. Ready, 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 ready. Lovely, lovely. I want to see more readiness in the chat. Keep your readiness coming. Keep your readiness coming. Lovely. Love it, love it, love it, love it. So please get your notepad, grab a bottle of water, and possibly some snacks you would want to munch on as we dive right in. Without further ado, I'd like to invite for her remarks our variant convener, a digital health leader, a public health innovator, a trailblazing pharmacist, and the brain behind the VC Health Tech Hub. Please make welcome Ezine Onwekwe.
Thank you very much, Taiwo. That was amazing. I don't know how to follow that up. I'm not an event compare, so please bear with me if I don't speak as well as Taiwo, but I'll do my best. Well, thank you very much, ladies and gentlemen. We have quite a lovely audience here, and I want to thank everyone who has made our time to join us and those who join us and those who will listen to this afterwards, because we're going to make this available to everybody afterwards. And so it's a beautiful location. And I know people are wondering, why do we have to do this? That's a question. Why? And I posted something recently on social media. If you want to know our why, come and join us. So the VC Health Tech Hub started late 2023. That's when the idea, the concept started. And we had that FEX program that Taiwo actually compared. And we brought together a couple of young innovators as well to talk about building digital skills in Africa. And that was the birth of the VC Health Tech Hub. And we have gone on to do amazing things in the space of 1 year. We have trained and mentored about 350 people in digital health skills. We've had over 7 events, from organizing flagship programs, the digital health training, to hosting boot camps, to partnering for the digital health week events with collaborators, to hosting International Women's Day events that focused on digital health solutions. We've had so many things across both on digital health all across Africa. And these are programs that has brought together people from across the continent. So when I talk about VC Health Tech Hub, it's not just a Nigerian organization. Yes, we are from Nigeria. I'm Nigerian, and the organization registered in Nigeria, but it's a Pan-African organization. And so why are we doing this today? We want to put that footprint that we are a capacity building organization. So sometimes what is in a name, that's a question. And we felt that it's important that we have this solidified, that when you think of digital health skills across the continent, you think of our name, digital health skill. It is right in our name there. And that's why we have decided to do this relaunch. And rebrand, and the concept is still the same, the ideology is still the same, which is building capacity of healthcare workers across Africa. And how we're doing it is very much the same. Better strategy, of course. We learn as we grow. Every organization re-strategizes, learns from what they've done before and moves forward. But the idea, the core why has always been there: build capacity for healthcare innovation. So we're not just building capacity for capacity building's sake. We're building capacity so that people can innovate. So we are building capacity so that health system challenges can be solved. We're building capacity so that you and I, who have healthcare backgrounds, can start seeing solutions in the places where we find ourselves. So we are not looking for African solutions to African problems. So that's why our facilitators, our programs are all within the African context and from African trainers and African approach to everything. So I want to thank you all today. This is not a very long speech. It's a very short one. So I want to thank you all today, and I want to thank everyone, speakers, those who heed to our call to be on the panel, to speak today, to moderate, to be our MC, to my team, to our board of trustees who have been with us on this journey for the past 1 year. And I hope you're going to continue to work with us, and our partners who are on the call as well. I've seen a couple of them, people who've collaborated with. I hope we'll continue on this journey as we improve and get better over the years. So thank you very much for this opportunity to be in front of you today and try to talk like Taiwo. And thank you so much, and I hope you enjoy the rest of the event. Bye. Thank you.
Thank you very much, Ezine. Please give it up for our very own convener at the VC Health Tech Hub, soon to be rebranded. All right, thank you. Indeed, like Ezine said, just a little over a year ago, I was right in a similar virtual room where we launched the VC Health Tech Hub, and it's so incredible to see how much growth the hub has experienced and how much impact the hub has delivered to the African people, to the young people of Africa. I'm indeed thrilled about the new strides and impacts that the hub will make following today's relaunch. So sit tight as we dive right into all that we've planned ahead for today. Coming up soon is a keynote speech by a very, very distinguished health tech innovator across Africa. She's somebody you should listen to. And to introduce her to us is our very own moderator. He will be introducing our keynote speaker and also moderating the panel session that we've got lined up. Our moderator for today is a world-class technology leader with a decade of experience building innovative digital solutions. He actually is the founder and CEO of StoreBounty.com, a newly launched cutting-edge platform that provides software solutions for retail businesses, including pharmacies. He is a talker. He is a proud member of the Eagles Toast Masters Club, Nigeria. If you want to improve your public speaking, you absolutely should be a member of Toastmasters Club. Ladies and gentlemen, please make welcome our moderator for today, Michael Orokola. Over to you, Michael, for the introduction of our keynote speaker.
Taiwo, thank you so much for that introduction. And I want to welcome everybody to this program. Like Taiwo said, I'll be introducing an icon. I've had a name dropped every now and then in the industry. When I posted the flyer yesterday, someone in my network said, "Oh, you know Abimbola." And I said, "I will miss her today." So I'll be introducing an icon. Like I said, I love the way the profile given to me is written, so I'm going to read it as such. Please bear with me. I'm trying to be sure I get this right. Abimbola Adebakin is a certified performance technologist, a pharmacist, management consultant, and tech innovator who drives performance improvement in African healthcare. She's the founder, CEO of Advantage Health Africa, enabling access to quality and affordable healthcare in Nigeria through market access and pharma distribution, and leveraging technology and aggregation. She's formerly the CEO of Tony Elumelu Foundation. Abimbola is the Public Relations Secretary of the Healthcare Federation of Nigeria, HFN, and a board member of the Save Medicine Foundation. She is a master trainer with the Institute of Directors, IOD, mentors for Wimbees and Google Startup, and serves as program director of the Pharmacists Leadership Stimulant Program, promoting career stability for young pharmacists. Abimbola's remarkable achievements have earned her prestigious awards, including the Bayer Foundation Women Empowerment Award 2021, Google Black Founders Fund 2021, Joseph Business School JBS Global Entrepreneurship of the Year 2022, Super Achiever Healthcare category at the Peak Performance Woman of the Year Award 2023. She wins Africa 2024. Please join me in welcoming to the stage our keynote speaker from Abimbola Adebakin.
Thank you. Thank you so much, Michael. Thank you, Taiwo. Thank you, Izine. And I see so many young faces here and several people that I know from your names. I see Tommy here. I see Grace. Hello, everyone. I'm happy to be here with you. Despite being a Sunday when ideally we should all be resting, we're building capacity. So this is after my own heart. Because we need to catch up very quickly and leapfrog if we're going to make the right impact and bring value to the committee of nations, committee of continents who are adding value to solve human issues. So thank you very much, Izine, for having me speak very briefly. I'm not sure how many minutes I have, 10, 5, 15? How many minutes?
25.
Oh, okay, 25. You permit me to use a deck of slides to share some thoughts so that I can, hopefully, I will provide coherence in my thoughts. Thank you so much for this topic. When I came back into the industry in 2017, one of the ills that I saw was the rampant presence of silo pharmacies, independent pharmacies, all across Nigeria. On one hand, we didn't have enough pharmacies because ideally we should have about 200,000 pharmacies serving the population. But on the other hand, the few pharmacies that we did have then, about 5,000, were underserving the people and were more or less struggling to survive. It was an anomaly. It was an anomaly because ideally when you have low supply, you should have high demand and you should be overwhelmed with, with demand. But that was not the case and still isn't the case. There are other several reports that say we have 6,000, we have 8,000, but it's still not enough. So when I set up an online pharmacy, it was to help to bridge a gap in access to affordable and generic medicines because of an existing silo problem. Independent pharmacies were rampant, and you could find them individually struggling with the commonalities of issues across the country. Access to the right people, access to skills, access to markets, access to resources, almost every pharmacy could recount to you the same issues. If you go to the medical field, almost every clinic could recount to you similar issues. If you go to the primary health centers, similar issues. So it is obvious that our smallness does not serve anyone. It does not serve the operators, nor does it help us to serve people better. You know, in the past, when doctors worked with their portfolio or with their briefcase and they went house to house, it served the purpose of intimate care. So you could call on a doctor, come to your home, see you, give you that care, and would remember you and have your, preferential treatment and all of that. It no longer serves us to work individually in that manner. We now need scale, because guess what? Not only is Nigeria highly and densely populated now, but from all projections, by the year 2050, our population would make us the third most populated country in the whole world. And we will need to solve for obesity in 2050, for diabetes in 2050. We need to solve for high blood pressure and all sorts of chronic illnesses that are creeping into our population now. Now that we're about 200, 220, 230, then we will be about 400 million, and we need to start to solve for scale. We need to understand that what is working now cannot sustain us in the next 15 years. So when I'm talking about 2050, it isn't so far off. 2050 is just 25 years away. So the children that will be 30, that will be 28, they're already born. They're already existing. And to care for them and those that will come after them, we need to ramp up scale. Working in silos has not served. If you look at countries that are like us, and I like the studies that have been done by the Big Four, where they first identified, helped countries to identify who their peers were. There's one, I think, was done by, it leads me now, BSG or BPGS or so. A study was done that listed the N11 countries. Nigeria is one of them. Vietnam is one of them. Mexico is one of them. So they were the N11 after the initial original BRICS countries. South Africa joined the BRICS, so it became BRICS, and then N11. If you want to compare yourself to countries, then pick that list and see what happens in Mexico. In Mexico, you see a chain of pharmacies having 5,000 branches. In Nigeria, and as I speak to you today, the figures are out there for you to check. The largest chain of pharmacies in Nigeria is not up to 200 branches. Yet, efficiencies happen when you run chains. Why? Because you can bulk purchase, you can negotiate, you can deploy technology systems, and it will have higher impact. You can deploy one solution maybe to address pregnant women, and you can deploy it in all the branches. There's uniformity of practice, there's standard operating procedures, there are quality measurements that will have widespread impact. But if you choose to do it in 200 branches, you have to contend with 200 owners, and you have to contend with 200 different sets of ethos and value systems. We cannot progress working alone. We cannot. And so we need to build the skills to expand our healthcare system beyond silos. We need to move from silos to systems. Now, moving from the traditional healthcare system to now see the players that have said, all right, we understand that to leapfrog, we need to embrace technology. Therefore, we can bring in some digital solutions. But even then, as digital providers, we find ourselves working in solo systems, working by ourselves, isolated, insulated, and not connected. It does not serve anybody. It does not serve. You might have a flutist that is remarkable, that is incredible, that is award-winning, but have you heard the power of an orchestra? When they play beautifully, in symphony, where the flutists, the cellists, all of them know their time, they know their tune, they carry the song, and ultimately you have a performance. That's where we should be going in Africa. Gone are the days when we could say one big, strong company, one big man. You know, we come from the historical, what we've inherited historically has been strong kings, strong queens. You know, one Queen Amina of King Jaja of Opobo, and so on and so forth. That no longer serves because we saw the cracks that happened when people came in to colonize us. They could colonize us because we were separate and we were not a formidable, united people. If you want to cause change to happen, you must think in terms of systems. Systems build. When we build too much around people, it has the inherent tendency to fail and crack and be subject to weaknesses attached to the person. But when we build around systems, not only are they reproducible, not only are they replicable in other environments, they are more sustainable, meaning they can withstand the heat, they can withstand the pressures that come with just living. Africa, not just Nigeria, Africa has gone through tumultuous changes in the past few years. You look at the economy in Kenya, in South Africa, in Nigeria, in Ghana, even in Egypt and so on, we've got a nosedive of the valuation of our currency. We have a lot of exodus of our experts because we're largely English speaking, at least the countries I have mentioned. So the English speaking West has found a place where they can quickly and rapidly take a lot of professionals, and many of you have demonstrated that on this call. So what we're building here that was meant to serve us and was not enough is easy picked for those other countries that can take away. So there's been an exodus of expertise, an exodus and a weakening of our systems here, and Africa still has to survive. Our 1.3, 1.4 billion population is the youngest population in the whole world. The impact for me of that sort of population is that when the world around us is aging and getting weaker, we have to block the gaps that come from their aging population, and we in this continent therefore need to produce value. We need to be able to show we can carry the whole world and take it to the next level and not take it down. So Africa has a strategic role to play. We cannot continue to be the poor cousins. We cannot continue to be behind when things are being discussed as though we have no part to play. We cannot continue to be, not be reckoned with when decisions are being made for the next 30 years. Because in the next 25 years, will be the most populous, Nigeria at least, the most populous country in Africa. We are in Africa, but the third most populous country in the world. In the world. It's about time that our healthcare system can serve us and serve other continents. So this is not just about, Nigeria should be good, let's even build for Africa. We need to begin to think of the implications of an aging population all around us, and we are a young population. That means we need to feed the world. And in feeding, I'm not talking about just agriculture. I'm talking about a workforce that has to serve the world. So we need to build with that in mind. So many solutions, of course, naturally start with sparks of ideas from individuals, but it doesn't have to stay like that. We've seen the weaknesses of building around individuals. We must build around systems. Yes, it's beautiful that we've been celebrating our startup landscape, our ecosystem across the Digital Health Africa. This is the 2023 landscape check that was done. You can see how we've categorized ourselves into verticals, diagnostics, telehealth. I hope you can all see. Can you wave? Okay, great. So we've done analytics, we've done all the health financing guys, we've done, I think we sit nicely in the pharmacy aspect, we sit, the supply chain and logistics. In reality, several of us play across different verticals, but that's not even the point. How well are these individual entities that are in the landscape able to withstand the winds, the rain, the heat that is in the land? How well are we scaling? Are we reckoned with on a global scale? I mean, it's beautiful to be able to say, oh, we showed up in the African landscape. Are we showing up in the global landscape? Hardly. Very few of us showed up in 2023 and they've gone under. Examples like 4G. Some of us were not existing in 2023, are now existing, but are struggling to raise funding to take us to the growth phase that we need. Some of us then were doing one thing or the other in 2023, have had to pivot to do something else in 2025 just to survive. I read a report recently that said if you started off 2015, 2017, by now on the average as a company in digital health in Africa, you should be doing a revenue volume of about 3 million. Many, many, many of us do much less than $1 million. But they compare that $3 million on the average for an 8-year-old, 9-year-old company to the average across the world in the West, which is about 8 million. So we're still far behind in terms of what we're producing, in terms of the impact of our value to the world. And then now we're being told that, our solutions are basic and even simple. They're not, in quotes, innovative. Now, there are many discussions you can have about that. One could say, well, what we need in our own reality in Africa are really basic infrastructure changes and things that we even, first of all, even take health rural, or take it to the gentleman in the marketplace, or take it to the woman that is struggling with her. So we do need basic solutions. But gone are the days when those arguments lead us to the front. Now there are prototypes of robots or agents that can swallow pills, and their internal environment mimics my internal environment, such that when that robot or that entity takes the pills and the side effects show up in that entity, they can know from a personalized medical care perspective that I would have the same side effects. Therefore, they can avoid that in my care. We're still very far away from such levels of care. We still use AI in rudimentary ways, and we need to begin to use it in more impactful ways to become less dependent on outside Africa for our drugs. So we need to use AI for medication discovery, for medication development, for medication production, for medication testing, and then ultimately for effective distribution across the world. We are sitting in a jungle as solutions to chronic care issues that the world has struggled with for decades, for centuries. But if you look at our history, you find people who can swear to having taken some leaves mixed with something and rubbed in some sweat, and then you lick it and the disease goes. But where are the studies that were done, are being done now to show the authenticity of that solution, to show the validity and reproducibility of that concoction, and to show the safety margins of using that contribution to healthcare? Doesn't exist. We can accelerate such with AI. So I love the landscape. I'm an advocate of the landscape. I'm a proponent of working amongst ourselves. But for too long, we have celebrated and over-celebrated our to move up, move higher, rise up to the next 3, 4, 5 levels that will make us be reckoned with on a global basis. The leapfrog. Yes, digital health is a great enabler in the delivery of healthcare services, and it will help us to get to the overall objectives of universal health coverage, which are availability of the healthcare, availability and accessibility, accessibility, and affordability, because it might be accessible, it might be available, but not affordable. But in all of this, with equity. I would have liked to add quality. That's fine. Now, collaboration for me is, however, an angle that we have under-emphasized. Leapfrogging is essential. Digital health is essential. We can make impact if we keep at it. But to actually get further, go through the minor steps, the minute steps, the minor steps that others went through. We must jump ahead. And we've seen it happen in financial services sector. Africa at the time was leading with all of the innovation around SMS banking, mobile banking. We've done quite a lot that the West had to learn from us to use. There were when if you did a transaction in our fintech or in our banks, you got your deposit the same day, you got your credit the same day, the transaction happened. In the US, it took 3, 4, 5 days. Not sure how fast it is there now. With solid solutions around security in cybersecurity. So for me, we can do it. We have precedents to show. Other sectors in our Africa have leapfrogged. So there's nothing to hold us back. There's no inferiority complex for us to embrace and romance. We can move forward. I think each one of us here at this meeting begins to think, because we're not of an underage cadre. Many of the people who are leapfrogging and doing fantastic, awesome things are as articulate as we are. They are as confident as we are, educated as we are. We need to embrace some maybe additional. Internet and various parties now are committed to enabling us to get that level of exposure. Now, rub that exposure with your competence, your intellect, your emotional stability, and you can find that you can do all the leapfrogging needed. I have just a few minutes left, but I want to just share some examples that come to mind of how we have, tried to embrace partnerships and collaboration, and choose 1, 2, or multiple forms, to get things done. For example, we partnered with the regulator of pharmacy practice when we said, look, we need to help to solve a problem that we were seeing with interns in pharmacy. We were losing them rapidly. So you were each school of pharmacy, but they were leaving the sector into other sectors or leaving the country and not even carrying out their full internship. Or some needed to carry out the internship attachment, but they were waiting 2, 3 years because there was a particular organization they wanted to work with. So we set up the pharmacies, to help to stimulate the mindset of a set of pharmacists every year, for them to see themselves as solutions providers, more enabled, more confident to take on what is needed in the workforce. And we're seeing a lot of results of many staying in pharmacy or checking out of the country, but staying within pharmacy, still adding value, mixing product development, mixing health financing, mixing health economics, mixing various things with pharmacy. So not jettisoning it, thinking of it as an inferior course, but now understanding how they can annex, multiple. So PLSP is an example. I call on many of you to see how you can collaborate with the regulators. There are many challenges regulators have. They have limited resources. So if you can do anything with them, beautiful. You can partner also with Big Pharma or the original equipment manufacturers or donor agencies like we have done with Bayer. Bayer is a German company. We collaborated with their foundation And even now, we're exploring collaboration with the pharma company itself. Associations also can be powerful collaborators. When we aggregated 1,000 pharmacies across Nigeria, it was the first of its kind. They had not heard that, so I had to become sort of an evangelist, going from zone, going from meeting to meeting, going from, and so on, preaching the message of collaboration. The result was overwhelming. Almost 1,000 pharmacies agreed to work together to solve access to market, access to resources, and access to skills issues that we elaborated. So ACPN, PN, these are associations that you can work with. I'm sure in the medical field, I'm sure in the nursing field, in physiotherapy, you can work with them and get things done. We can have partnerships with intra-industry entities or inter-industry. And the point is identify, go to that landscape that I just showed you, pick up someone that you know that if I should give them my own value proposition, they probably need it, and we can work together to solve the ultimate problem, which is access, affordability, accessibility, and equity of healthcare to the last mile. And then you can find individuals. And there was a program that I helped to reignite at University of Lagos College of Medicine called STARK, or was it STARK or STARK? And I got them to say, you know what, let's have a pitching, program where each medical doctor or pharmacist or anyone from the medical field gets someone from law, from technology, from economics, from HR, wherever, to collaborate, form a team, and come up with a healthcare solution. It was wonderfully, accepted because I thought, look, let's rub minds together with others. Let's see what other sectors are doing. Find someone in entertainment and see how your health education and their own perspective to music, drama, or any form of entertainment can marry, and you can advance health promotion and health prevention. You do know now the work that Apoko does is not pure medicine that is taught in school. He has combined his learnings from other fields. He has been an actor, he's been a skit maker, he's this and that. He's combining that to find solutions to tell people how to prevent or promote things. You can find someone in rehabilitation. You can find someone for restoration and so many other aspects. So treatment is not the only aspect of healthcare that we need to look at. And we've been doing all of this in AHA. We have multi-stakeholder program right now running in Kaduna that's got 5 partners, 2 of us in healthcare, 3 in agric. And we've combined our skills, our leeway there, and it's running. What we're doing is a 3-year program that's funded to the tune of to get medicines and other healthcare products to the last mile for at least 500,000 households in Kaduna State. And it's running, it's working. And we're not doing it solo. We've combined our forces with Jennifer H. Foundation, Healthy Entrepreneurs, Effects for Healthcare, and Coamana, and we're running it beautifully. So there are various things you can do. You must think out of the box. You must bring your solutions, promote it, propose it, think through what are the ways we can collaborate so that we can aim for skill and not just keep patting ourselves on the back doing small things. Small things have paid us in the past, but they're no longer where we should stay. If you've been playing small and you want to scale, I think a veritable way is to leverage the existing parties that are there who are doing fantastic work. It's not for you to come to say, oh, they've been doing rubbish, to criticize them and try to jettison them. This is where we do co-opetition, where we collaborate with our competitors. Because when you collaborate with competitors, you both because the market is out there and you're both not reaching the full market. But when you join forces, now you can scale. You can make yourself partnership ready by lowering some human egotistical standards that are not paying off for you, but you need to just, remove them from the equation and be more open to say, this is my own strength this is your own strength that you bring to the table, and we do not feel threatened by our strong personalities. Instead, we see that this person can advance, he can plant, I can water, and we can see growth. That's where we need you to begin to think. But when everything is about you, the founder, it's counterproductive in the long run. So let's have mutual benefits. As each one of us is delivering value as an innovator. Each one of us is intentional about fostering partnerships. Each one of us has seen the light that running solo is not the way we will solve for Africa, that Africa has to serve the world. Each one of us can understand that we must integrate, we must collaborate for scale. That's when we can attract the right funding. We can get the grants, get the loans, get all that is needed, get the people to work with us, get expertise, get the government to bend to our will because they can see our value that we bring to the table. I hope that this is helpful. Ginger some of your thoughts around moving from silos to systems. Thank you very much.
So good, so good. Thank you so much, ma'am. I know that after listening to that igniting keynote speech, you definitely are charged and catalyzed to play your part in changing the narrative in the African digital healthcare landscape because Africa is waiting for us. No one will do it for us if we do not rise up to do it ourselves. So we've got to step up, rise to the occasion, and do what we've got to do. Indeed, beautiful presentation. I see a lot of comments in the chat. I hope that beyond the beautiful presentation, nice, you will really, really take actionable steps going forward because that's what we need, the actionable steps to move the needle, to change the narrative, to move Africa's healthcare sector, healthcare system from where it is to where it needs to be, democratizing access to quality, affordable healthcare, making sure that we truly, truly achieve healthcare for all, the universal healthcare coverage agenda. All right. If you haven't noticed, Abimbola Adibake is my CEO. So I guess we enjoy all of the many insights that you all just enjoyed in a very few minutes. I get to enjoy it every time. I'm sure you must be jealous of me already. All right. Thank you so much, Abimbola, for such an inspiring presentation. All right. I will go right now to hear from the VC Health Tech Hub team. They have done magnificent work in over a year. And in the next few minutes, we will look through the impact report, the success story of VC Health Tech Hub, and they'll be sharing that with us, even as we transition to a new brand name to enable us to even do better work on the continent. All right, over to you, Tim.
All right, thank you so much for that presentation. And we're just going to take a quick break between the keynote and the panel session that is coming up next, which will hand over back to Michael to take over. And we're going to play a video, not the impact video as it is, but a video that shows how we've grown from someone who had done the first cohorts and has come back to volunteer for the organization. And we want to hear her story and how much impact and how much change that she has undergone, that she decided to come back to work with the organization, given the impact that she has gotten. So just
Hello everyone, my name is Roslyn and I joined the VC Tech Hub as a volunteer community manager for their latest cohort, that is the cohort 2. And that is because I had such an incredible experience as a participant in the first cohort. So I wanted to give back to this amazing community. Now, I basically get to engage with members, organize fun activities, and ensure everyone attend classes while highlighting their importance to them. And we also dive into health-related discussions, making the community very vibrant and supportive. So working with diverse members and seeing their unique perspective on health topic has been really so inspiring, and I'm excited to continue learning and growing with VCL Tech Hub. I'm here to build stronger tech savvy community together. Kudos to everyone at VCL Tech Hub and all the new cohort members. Thank you.
So that's
Hello everyone, my name is Roslyn and
that's Roslyn, our community manager, and sharing her story. She's a pharmacist who is integrating UI, product design, UI, UX into her work as a pharmacist. And she's also working as a community manager in the VC Health Hub. And I know the cohorts, if you are in cohort 2 and you enjoy what Roslyn does, please put in the chats. I want to hear from you. I want to get reactions from you. I know most of you are on the call. What Roslyn does is really amazing. What she's been doing for the cohort 2, she's the collaboration, the engagement. It's pretty amazing what she's doing for the team. So I'm going to hand back to Michael to continue the next section. Over to you, Michael. Hello, Michael.
Sorry, I was fumbling with my microphone.
Oh, sorry.
Okay. To go to the next segment of the program, I must say that I don't know about anybody. To me, Farmer Bimbola delivered a dream, not a speech. I consider myself a very recent entrant into, or a stakeholder in the healthcare sector, because my company provides software for pharmacists, for inventory, sales, and stuff. But when I listened and I was glued to my screen, what I heard today is a dream bigger than what I thought. I must confess that I limited myself pretty much to the niche of the problem we were solving. But having listened to her today, I almost feel bad that I didn't expand the scope, but I'm also very charged going forward to say the problem is big. The landscape needs us right now more than ever. And more importantly, she sold the idea of collaboration to me more than ever before. So I'm personally grateful for that wonderful speech, madam. And I'm sure a lot of other people have similar things to say about that speech. So to go into the next segment of the program, I have two people who will work with me, who are my panelists, who will work with me on this. So I'll be reading their introduction. I know Taiwo has set the standard for this event so high, so I'll just do my best. Pardon me if I'm not living up to that standard. So the first person I'll be calling to the stage is our host. In this case, will be my guest. And that is Ezine. I don't want to murder your name. Onwukwe. Did I get it right?
Onwukwe.
Onwukwe. Okay. Please pardon me. And I'll be reading her profile as provided to me. I love to read as provided to me, so I don't butcher anything. Ezine is a digital health strategist with over 10 years of experience. With over 10 years of international experience in integrating clinical expertise with data-driven solutions. With a proven track record of transforming healthcare through digital health, Ezine has spearheaded preventive healthcare, vaccination, epidemiology, supply chain high-value programs across Africa. Managing a drug revolving fund scheme in Nigeria, she optimized processes to reduce drug wastage and enhance service quality for over 60 health centers. Furthermore, Ezine worked with a team to operationalize African Center for Disease Control and Prevention, Africa CDC, Southern Regional Coordinating Center, RCC. She also coordinated and provided technical expertise to continental COVID-19 vaccination data intelligence and visualization efforts across Africa CDC. She actively contributed to the development of the African CDC COVID-19 vaccine dashboard, providing real-time information for 55 African countries. Ezine is committed to making social impacts in the digital space by working with organizations to create positive change. She has collaborated with 1 Million Get STEM, UNESCO, Tech Camp, US Department of State, Women Tech Makers, Google, Digital Health Canada, International Federation of Pharmacists, FIP, and many more. She's also the founder and executive director of VC Tech Hub, a nonprofit with a mission of building a digitally enabled healthcare workforce to drive healthcare systems innovations. Ezine is a member of the FIP Technology Advisory Group and currently a senior clinical informatics analyst in Nova Scotia Health, where our current contributions are focused on a provincial digital health transformation project. One person, one record. And the next person that will be joining my panel is a medical doctor. Please give me a minute. Okay. I also struggle to pronounce the name. I'll try my best. Dr. Esperance Luvanda. Dr. Luvanda is a medical doctor, healthcare management specialist, digital health consultant, and international speaker. Our accolades include being listed on the Forbes 30 Under 30 list, and most recently being named Echoing Green Fellow. Please, if your hands are not busy, let me welcome these two distinguished professionals to the panel. Dr. Esperance, thank you for joining us. I hope I didn't butcher your name too much. Please pardon me. I'm an engineer by training.
Not too much. You got the name right. The surname is Luvendao, so well done. You did fantastic.
Okay, thank you. Thank you. Without further ado, I'll be going through. I have a lot of questions on my head, personally, but to save time, I'll be going through a few of them. And I'll be going, from one person to another. Just give me a minute. Okay. Let me start with our host. Ezine, I want you to tell us, and I know it's a question on a lot of other people's mind. It's a question on my mind. How do you see digital transformation reshaping healthcare in Africa?
So thank you very much for the question. And so digital transformation is a buzzword that has been around for quite a while now. And it's more like AI or digital health. And so it's revolutionizing how healthcare is practiced in Africa. And you can he addresses accessibility, affordability, efficacy challenges with things like mobile health applications, with things like telemedicine, AI-driven diagnostics, electronic health records. All these things are becoming more patient-centered and data-driven with digital transformation, and that's how it's reshaping healthcare in Africa. So the rapid adoption of digital health solutions is going to bridge the gap between the rural areas, the underserved areas, and the urban areas. I know there's a tendency for this to also widen the gap, but if it's played well, it's going to bridge the gap. It's going to improve disease surveillance. It's going to enhance healthcare delivery through these things I've mentioned before, like the mobile health apps and the rest of them. So however, scaling these innovations, they require investment in policy, infrastructure, and of course, what we're here for today, workforce digital literacy, to ensure there's a long-term impact. Thank you.
Thank you so much for that answer. Dr. Luvanda, I want to hear your answer to that question as well. How do you see digital transformation reshaping healthcare in Africa?
So I 100% agree with everything that has been said. I think that the first thing is to understand, and I say this all the time, is that digital health, so to speak, is not the future, it's the present. And once we get to understand that, it helps us to understand that things are moving at a much faster pace than we would have thought. At first, digital transformation was a foreign word, it was a foreign term. At first, digital health was a foreign term. And later on, we got to understand that when we really understand how fast things are moving, it allows us to understand that on the other side of the world, and I remember in the year 2022, I spoke at the largest health tech conference in the world, and that was in Dubai. And, they were talking about these digital hospitals and how the future and the present, the future for some countries and the present for other countries. So while some countries are looking at it as a far-fetched thing, other countries are in the trial phase where a full clinic is being run on the other end of the world solely on digital health, which means that there is no intervention from human beings and people are coming into the clinic. Yes, within the pilot phase, where people are coming into the clinic, their blood pressure, their pulse, their temperature, all of that is being done without the need of human intervention. Now, I was fortunate to attend the Health Tech Summit very recently in Rwanda. And one of the things that came up then is this question that keeps popping up to say, is this not going to outphase, human beings and make us now not needed? And should we be worried about our jobs? And my answer to that ties in with the answer to your question to say digital transformation is not the future, it is the present. That is the first part. And the second part is that the ones that make digital transformation, digital health, a part of them now are the people that stand to benefit from it the most. So it's not a choice. It's not something where we can say, okay, well, I think it's going to replace people, so I do not want to be a part of that. It is something that has already become the present. And the future of healthcare relies on that. So we've tried to make healthcare in rural areas accessible to everybody, and we have failed dismally. Digital health offers an opportunity to make all of those things a reality if only people are open to the possibilities that truly exist.
Amazing. Thank you for that. It means for us in Africa, we're already maybe a decade behind if people are already in the trial phase of this. Thank you so much for that answer. I'll go to my next question, which I'll be directing it to Izine. What do you consider the top priorities? I mean, we've been talking about it's present, it's the future, we should have been there. What do you consider the top priorities for building digitally enabled healthcare workforce in the next 5 to, say, 10 years in Africa, or maybe for the rest of the world as well?
Okay, for Africa, the first thing I usually talk about is that there isn't an alignment between what is taught in the universities or what is taught in the schools and what is expected of the industry from you when you get into the workplace. So that's the first thing that is priority, is to bridge that gap between the education we're getting from schools and what is expected in the industry. So curriculums need to change. Curriculums need to be updated. And we need to foster cross-disciplinary collaborations. Today, we're talking about collaborations between healthcare workers, the technological industries, and experts. And secondly, there has to be, because digital health is it's a snowball, like it never stops. We need to keep learning. So what is obtainable today is not what's going to be there next year. So you need to keep that continuous professional development has to be there. So that's the second priority. I think it has to be there. So there has to be continuous learning. So we don't just, oh yeah, we've updated our curriculums and that's it. When you get out of school, there has to be a conscious attempt to have that professional development continued. And thirdly, there has to be, I think, investment in infrastructure, broadband infrastructures, digital health tools, and of course, policies that are friendly to workforce and capacity building initiatives. So if there are policies in place that can help us to facilitate this curriculum developments, that will make it move faster. But then it's a chicken and egg thing. Policies have to be in place, and then we also need to also build a curriculum. So policies have helped for these things to happen. So for me, those are the top priorities for this, to build a digitally enabled workforce for the next couple of years in Africa.
Thank you so much for that. Policy. Thank you so much for that. My next question is to Dr. Luvanda. There is a term in Nigeria, I don't know if you're familiar with it, called JAPA. JAPA means the brain drain that we experience. I'm sure it's all over Africa, but it's a lot in Nigeria. So I want to ask you, what do you think would be the strategies, or that especially the ones you've seen implemented in other spheres, for implementing, empowering local talent to take ownership of the digital projects that we have in Africa, to do the innovation that we've been talking about? What are the strategies you've seen implemented in other spheres, or the things you consider should be embraced by us in Africa to in empowering the local talent?
Okay, so I think that firstly, I wouldn't necessarily say I've seen it implemented elsewhere, but I would say it would do us good. It was something that we would consider okay within African sphere. And that is, I've spoken about previously, I believe it was at the Health Tech Summit or the Public Health Conference last year, where I said that, number one, we need a unified body that allows us to, from the top, it allows us to put in order and to put in place exactly what she mentioned now in terms of policy, in terms of regulations. The note speaker mentioned in terms of duplicate efforts. And so it's not that young people are not interested, not that young people are not innovative, it's not that young people create. After the health tech set, I had so many young people reach out to me on LinkedIn saying they are the innovators and they've innovated that. So the creativity is there. I think we need to be careful of times making it seem as though often young people are behind. They're not behind. What is behind is the implementation there of these innovative strategies into systems, make sure that they benefit Africa as a whole. And so that comes to answer the question to say that, number one, we need a unified body from an African perspective that oversees the same. You have the Africa CDC that oversees from that perspective, right? We need a body overseas in Africa, because what does they do? Why it takes away from, you see, the keynote speaker made how collaboration is so important, and particularly with digital, it has become such a major issue because you have young people every single time, and every time I open LinkedIn, there is another digital body that has created for young people, and the problem is we are taking. And that is where we continue behind. It's our greatest problem, is that it's not that we don't have the right efforts. We have the right efforts. We have innovative solutions. I myself, I've created a digital health solution that allows people from informal settings to access prescribed medication, leaving their local areas. I see young people all over Africa coming up with the most creative ways to solve our healthcare issues. So the problem, I don't think, is necessarily to say young people need to look and, so to speak, copy what is being done. No. We have developed solutions that are valid for Africans, which is fantastic. That can, number one, oversee, sure, if Esperance from Namibia, it's a digital health solution to benefit people. It is not a digital solution being developed to benefit Namibians. It is a digital health solution to benefit Namibia, South Africa, Kenya, Nigeria, Egypt, you name it. And if the policies are carefully put in place, it allows us to be implemented without receive backlash from the systems that we have created in our individual countries, because we are operating as individuals as opposed to operating as a system. That's the first part. The second part, to summarize answering your question, is that what I've noticed, and while attending these conferences and speaking internationally, noticed that one of the things that they do very well is the time between idea to pilot implementation is very short. And I've noticed that very different within the African system, because a young person will start an idea, come up with an idea, and because of the various sort of, not I say position, but because of the various obstacles within the system that we currently have, this person will sit with this idea from 2017, and in 2024, they will be telling you that they're not yet gotten to the pilot phase. That's problematic. But then goes to reflect on young people creating these ideas. And they find, but our ideas never make it to the system. And so why? And so we need to make sure that we shorten the time from idea to pilot to implementation in order to ensure the systems are consistently developing. The systems overseas were not started like that. And it's important to realize, because sometimes if you look at this as created when it comes to digital health, and we say, well, these people have always had it right. No, they start somewhere. They create a robotic hand that is able to sense, as was created and was published in 2022 at the Health Tech Summit in Dubai at the Giant Conference. And it has sensors, it's able to sense, it's able to do all these things. And they quickly take it from an idea to the pilot phase, and they quickly take it into implementation. And that is one thing that we are not doing quite right, is that we are on ideas for very long. And once again, not the fault of the young people necessarily. It is a role of people sitting on, tech marketplace, for example, to look at it and say, we have leaders that are creating these $1 billion, how we do that, quickly capitalize on it and move it from idea to pilot phase. And within pilot phase, we can then see what are the weaknesses that we need to improve to quickly to implementation in system.
Awesome. Thank you so much. You mentioned a lot of the problems. I don't want to go over. You've answered it very well. That's why your network was not so good. I didn't want to stop you at all, because I could still pick pretty much everything you said. Thank you for that answer. To buttress more on that, I don't know how much time I have left, but let me put the last question to, not the last question, I will check if I have more time. But next question to Ezine. I mean, we're talking about these innovations, the one we're building, the one we hope to see. And I want to know, what do you consider the critical skills, digital health skills, that will be needed to build a workforce that can support the scale up of the solutions. I know our keynote speaker also mentioned something like scale up. Scale up. Let's leave the silos. What do you consider the skills that the critical skills needed to build such workforce?
So this is an interesting question because I hope, yes, I'm not on mute. Okay, it's an interesting question because you can't, there's an endless list of skills. So you can't start listing, okay, oh, you have to learn data analytics, you have to learn AI, you have to learn cybersecurity, you have to learn this, you have to learn that. There are a lot of skills that you have to learn, but there are a couple of things that are important for people to know. And the first thing for me, because we're heading towards patient-centered systems, is user-centered designs. And that's one skill that is important because you have to make sure that like I always say, African solutions to African problems. So does the solution fit the problem, the context, does it apply? And that's sometimes where we miss the ball. So if you have the skills of the user-centered design skills that you can apply, make sure that the person you're designing for, the context applies, you have the skill enough, you know that to be able to make sure that that applies. So you can scale up. It's also limits this thing of things failing because this is what applies to this person. And if it's for a rural area, it works. Sometimes we take solutions that are from urban areas to rural areas, and that's why it doesn't work. So, and take things from rural areas to urban areas and it doesn't work. So the first thing for me is that skill in user-centered designs. So the other skills, definitely the data analysis, health informatics, the AI, cybersecurity, the mobile health designs, the telemedicine operations. Change management is important as well because digital health is disruptive, where people are used to doing things a certain way and bringing in a new system of doing things. And so change management. So these are non-technical skills. I also feel that in as much as we talk about a lot about technical skills, the soft skills are very important. People management, project management, the communication, the problem solving, change management. You can't overemphasize those things because you have to learn how to manage that change process because people are going to push back. So if you don't manage that well, you're going to get a big pushback. And so that's very important. And I'll say that adaptability, cross-sector collaboration is also important. So when it comes to technical skills, the list is endless, but then let's not overemphasize. Let's not drop the ball on the soft skills as well.
Yeah. Thank you so much. User-centric design. I picked that. So I would have loved to continue my questioning, but I want the people on the call to also be able to ask you maybe one or two questions. Do we have anybody with questions? Is any question in the chat? Maybe just drop the question in the chat so I read it. Anybody with questions? Or you want to unmute your mic? I don't know. Just maybe raise your hand. Your digital hand. Let's see. You can just quickly ask the questions. Anybody?
Or we can continue while we wait for that.
Okay. Okay. So let me just ask. Why? Please drop your questions. Let me ask me one last question to Dr. Luvanda. Just keep pardoning me. This discussion is, I've personally considered African markets. I mean, until Farmer Bimbola gave me a knock on the head, I've always considered African market to be a small market. And the reason is I always look at I saw a report one time of the digitally connected people, and he painted the market so small. Then he also painted a very smaller picture of the ones with disposable income. So by the time you start looking at it, it looks so small. And when you're thinking of innovation or raising funding, you're thinking in terms of what's that one huge volume of of people that you of the market that you can say that you can make a promise to the investors about. So now we're talking about scaling up big. I want to know, what do you consider like sustainable approach, or at least one sustainable approach to scale up that will, with the resources we have in Africa, approach that you consider for us to be able to scale up. In short, I don't know if you get my question. The network is bad. Is it my network or her network? Can everybody hear me? The network is a bit bad.
It's my bad. Yeah.
Dr. Lavanda, we can barely hear you. It's
You can barely hear me.
yeah.
Okay, let me switch my video.
Okay, let's do that.
Yes, can you hear me now? My beta.
Yes, much better now. Much better now.
Okay, perfect. So, number one, I would say
Oh, we lost you again. We can't hear you again. We can't hear you again. We are pretty much running out of time. Is there any question from anyone? Okay.
So there is this question I get a lot, and I would like to answer here.
Okay, please go ahead.
So I think there's a hand. The person can put the question in the chat. I think there's a hand. Please put your question in the chat. It's easier for us to coordinate that way. Thank you. So there's a question that comes a lot about advice to young professionals who want to enter the field, or who are trying to enter the digital health field. And while we wait for Dr. Esperance to come back, please, you can keep checking for her to come back, because I'd like to hear the answer to her question. I just want to touch on that question because I get that a lot, and anybody who's in this space gets that a lot. And so what I would say is people should be open to, I think we should stop this thing of, I trained as a pharmacist, I trained as a doctor, I trained as a lawyer, I trained as a one field, and that's all I'm going to do. The world is at a place where there is interdisciplinary jobs now. There are interdisciplinary jobs right now, and we need to stay curious. We need to stay adaptable to the fact that things are changing. So the title pharmacist encompasses so many things right now. I'm using pharmacist as an example because I'm a pharmacist, and I have done so many roles, still being a pharmacist and still using the knowledge I gained in pharmacy school. So that interdisciplinary leverage and learning, I think Dr. Lavinda is back, is necessary. Reach out to people for mentorship. If you can't get mentorship, do virtual coffee chats, like 10-15 minute virtual coffee chat. Not everybody has the capacity to invest in a mentorship, but they can do 15 minutes of virtual coffee chats with you, like reach out to people and say, just let's stop for 10-15 minutes, and you can pick their brains, and that's fine, and you move on. So do projects, try to solve real world projects in this space. Not that you have to open an NGO or non-profit, but like solutions where you are, what solutions can you bring about? Join networks and stay curious, and that's what I'm going to tell people. So it's how it works for me, and it's how it's worked. A lot of people have talked to in this area. I still do virtual coffee chats a lot. I have a mentor, I have a career coach, but I still do virtual coffee chats to people who I feel and that I can learn one or two things from. So that's my answer to that question. So I know someone else raised their hand. I think Dr. Lavinda is back. I don't know if she can.
If you can hear us.
Yeah.
yes, I can hear you. My
Okay.
apologies for that.
You can go ahead with your answers, or you want me to go over the question again?
No, there's no need. Thank
Okay.
you. So what I was saying is that within the African market, the first thing to understand is that countries such as the DRC, Nigeria, have some of the largest populations in the world. In the world. What does that mean? That means that within our abilities, capabilities, and what we have been given naturally is the ability to scale much more than we've ever imagined, because the people are there, right? And it helps a lot, because particularly when you are a young innovator and you are applying for grants, or you are applying, and I myself operate in that space, and what usually helps to scale and get the people with the money interested is when they are able to see impact. And within the African system, we have a very great ability that sometimes we don't recognize as what I would call a superpower, to show the world, to show funders, to show donors, to show people that are willing to invest that this works. And a lot of the times with innovation, that is exactly what we're looking at. Does it work? Is it able to impact lives? When it comes to digital health, is it able to transform the lives of millions, if not billions of people? And within the African sector, innovators must be aware of that superpower. It is possible to create a digital health device that does not require internet connectivity, that educates people within informal settlements and semi-rural areas about, for example, women's health, and to take it to the market, to test it, and to get it to a place where you can now go back to the donors, the funders, and say, listen, this has affected up to date 500,000 people in Nigeria. And by so doing, it allows you to attract donors faster. And if we are being honest, people that are not within the space will always say, yeah, well, it's not difficult, just start. But if you are an innovator, you understand that a lot of the times putting these things together, whether it be an innovation, whether it be a digital health solution, requires money. And the best way to do that is to combine impacts. So what I would do is see what you can do that does not require funding in order to scale through impact, so that you can then say, okay, listen, the full solution would require this much funding. However, the amount of work that we have been able to do now with the limited funding that we have has allowed us to reach 2 million Nigerians. And therefore, with your funding, we will be able to reach 50 million Africans, or whatever else the case is. So use what you have in order to scale. Don't sit and wait for funding. That is the biggest area that causes failure for a lot of African innovators, because then they sit on their solutions and say, well, there's no funding. There's no funding to scale. And that is a problem. So use what you have to show impact. And by so doing, you will attract donors to further scale.
Amazing. Thank you. Thank you so much for that answer. Thank you. Let me move on to Ezine for the next question. Our keynote speaker spoke so much about partnership, collaboration. So I just wanted to buttress on that with this question, which is, how can cross-sector collaboration, public-private partnership, support skill development and system integration in digital health?
Perfect. So the PPP, the 3 Ps, how can they support development and system integration in digital health? So this is sort of like, this is a measure of funding, technology, and expertise. So, and you need these 3 things to be able to scale, to be able to develop, to be able to get to that system level in digital health innovation. And it's also a marriage between, I was listening to last year when we had the Digital Health Week, we did with Health Mythic, we had one of our speakers and he talked about the collaboration between government, academia, and industry leaders. These 3 do. And that's what the 3 Ps is all about. And so these facilitate skill development through specialized training models and training programs. internships, knowledge sharing platforms, and or whatnot. So this cross-sector collaboration is very important because, like I mentioned earlier, you have to make sure that what the policies that the government is bringing out, it's encouraging to, if we use the case, in fact, the example of the curriculum, that the policies allows us to change our curriculums fast and as quickly as possible, improve on our curriculum so that it matches what the industry needs. So that's an example of this triple P partnership. So there are so many examples that one can give, but this is one of the examples that I can give on that. And so it's very crucial that we have this partnership between these two people, and the collaboration is very essential because also, most times when we're talking about silos and systems and pilots and solutions that don't go beyond being pilots, and most times it's because they are not integrated into the existing structures that are there. So most times they're just hanging. It's like these trees that don't have roots, and once there's a little wind, it blows and then they die. So once, if the government's, if the private sector is within the public sector is sitting within the public sector, and there's that bond there, they interact, the health system adopts the project or the solution that is given, that partnership is strong, then you can have solutions that are long lasting. So that's just my point of view on that. Thank you.
Amazing. I believe in that as well. And then my next question goes to my two panelists. The impact of women, especially in healthcare, I can remember the statistics correctly. Most of the time it's usually like 70-30 when it comes to healthcare, the workforce for women and men. And most of the time it's because women care about people and men care about things. So this question goes to the two of you, Dr. Luvanda, and I'll start with Dr. Luvanda. How can women be integrated and represented in building digital health sector? So that I think a lot of the time when we see maybe the low level of innovation that we see might also be due to the fact that more men are in technology, more women are in health. So if the gap is still there when it comes to the innovation, one way for us to bridge that gap is to bring the two together. So how do you see women being more integrated in this digital health system that we are having this conversation about?
That's a fantastic question. I believe that we have already started to see that integration, if I'm being honest. The women, if you ask me off the top of my head, Esperance, who are some of the, let me say, for example, I am asked by an organization to say who are some of the leaders within the African digital health space, the leaders in that space. If I'm being honest, and I'm not at all being biased or whatever else the case is, but I would lean to probably 70% female women on that top 10 list and probably only 3% male. And that is because I operate in the industry, number one, from a clinical perspective, because I am a practicing medical doctor, so I work as an emergency doctor. However, in the digital health space, working as a digital health consultant for the Africa CDC's Health Tech Marketplace, and then also as an innovator. So I operate on all three levels, and I get to see it from that level on a day-to-day basis throughout the year. And I have noticed that women have taken up that role and that responsibility. I do not believe that it is as the old times where we would need to sort of bridge the gap to sort of say, okay, men are ahead, and so women need to try and catch up. I think women are, from my opinion, at this point in time, really dominating the space. And I'm not once again being biased, but I mean, look at the panel today, hint, hint. And so digital health is not the future, it is the present. And number two, pardon me, the more we talk about it, the more younger women that are coming up within the space. And when I say younger women, I'm not talking about age, I'm saying younger within experience in the field, keep coming up in the space, and they keep seeing people, and they keep attending, conferences or summits or sessions like this. They then continue to see examples. Way back in the day, we didn't have those examples. We didn't, in various sectors, we needed to have one woman sitting on a board for us to know that it is possible. Now you have about 7 out of 10 that are showing you that it is possible. And the more we hold spaces like this, the more people that are starting in the industry say, okay, well, this is a possibility. This is something that is doable. And this is something that I would like to venture in. Lastly, on this same point is to say that, and I think my co-panelist touched on this a bit when she spoke about the curriculum. I leave this here to say, in this day and age, it is not possible that we do not have digital health as a module in medical school. It's not possible. It is not possible. There is absolutely no way that your first introduction in the year 2025 to digital health comes from these little courses. However, you went through 7 years of medical school, mind you, like myself, without being exposed to digital health in that context. That is very dangerous for the girl child, very dangerous for the boy child. And so once we integrate it within those spaces already, you now begin to empower the young girls from a university level. And it begins to be an area where we can specialize in and speak out in rooms with a loud voice, knowing that we are truly knowledgeable from not just passion, but from knowledge as well. Thank you.
Thank you for that answer, Dr. Luenda.
And I will agree with her very much. I don't think we are being handed things, we are owning our spaces. And I'm someone who I've gone through a lot of mentorship. I've been in leadership positions. I've been in places where I've had visibility as well. And I see women in leadership positions, and that has given me the courage to also take up leadership positions and do some of the things that I've done. And so I agree very much with Dr. Esperance. And also what I want to add is that in creating products, when it comes to digital, I want to just add a different dimension to this. We talking about leadership positions, yes, and taking up like skills and being in the workforce and all whatnot about that, but also creating digital solutions that has to do with women. Women have to be involved in that decision-making process. So you cannot create a solution for me and I'm not involved in the process. And that's why you see that changing a lot. You see a lot of women being involved in the decision-making process right now. So if you look at for example, the marketplace you talked about, I think it's more than half women than men, and that's just one example. I saw the board, the team recently, and it's more than women than men, and you see that a lot happening. And because that's happening, more women are encouraged to take up spaces in the digital health sector. And for us here in the VC Health Tech Hub, in fact, this program has 60% registered as female than men. Men are like 38% and 62% are women. And so that's just something. And also in our organization, we tend to favor the females more. There's gender equity there. And so we make sure that we have more females taken into the program so that we can show them that this is possible and there's a space for you here. So I just want to add that bit as well. So thank you so much.
Thank you so much. We're so out of time. Left to me, I'd love to continue to ask you questions. I still have a couple of questions that I'd love answers to. But I will be handing over back to Taiwo, who will continue the program. I heard something today. I'm not familiar with the phrase, I think from is the name coffee chat, virtual coffee chats. I'm taking that with me. I'm going to go on and set up a lot of virtual coffee chats with, and if anybody, I'm in technology, and my company is building software suite for for the healthcare. We're looking into virtual clinic and pretty much any software suite to help in the for lack of a better phrase, supply chain of the healthcare. So if anybody wants to have a coffee chat with me, please reach out. So thank you so much. I'll be handing over back to Taiwo.
Thank you so much, and thank you, Dr. Esperance, for being such a great co-panelist.
Great one.
Thank you for having me. Thank you. Thank you so much.
Thank you so much. Many thanks to our brilliant panelists. You can see the brilliance oozing from them, and it's such a pleasure to be in the same room as them, to learn from them. That they condensed years of experience, expertise, and practice in the industry, condensed all of that in only a few minutes. And many thanks to you, Michael, for the facilitation of the moderation. Thank you so much. We have learned a whole lot so far. I'm sure that you all have. Please let me know in the chats. Have you learned something today? Are you energized by the conversation in the room today? Let me know in the chat. I'd like to hear from you. Let me know in the chat. Have you been energized by the conversation in the room today? From the keynote address to the panel session. I'd like to read from you. I see a lot of applauses by people in the chat and questions that we have asked so far. Tell me in the chat, have you been energized by the conversation? Oh, lovely. Thank you, Charlotte. Very, very much energized. Very, very much. It's a double dose, right? Of the energy that Charlotte has experienced. Yeah, great, lovely, lovely. Let's see if we can do a little energizer before we dive right into the rebrand of VC Health Tech Hub. So I've got a trivia for you all. Yeah, lovely. Thanks. Impact. So I've got a simple trivia for you all. Very simple. The crux of the matter is digital health, right? So I challenge you to form different keywords related to digital health with every letter in your name. Who is up for the challenge? I will go first and practicalize this. So I'm choosing my first name, Taiwo, right? Taiwo. T for telemedicine. A for automation. I for informatics. W for wearable apps. And O for online pharmacy. Do not repeat any of the words I have used. Who wants to try this? Anyone? Who's up for the challenge? Who is up for the challenge? Let's see. Do not repeat any word that I have used or that anyone will use. Who is up for this? I know we are all brilliant people in the room. So let's see. Who wants to try this? No use of ChatGPT. No use of ChatGPT. Who is ready to go for it right now? This should be easy. This should be easy. I'll count to 10 and see who is able to deliver on this challenge. 10, 9, 8, 7, 6, 5. Okay, isn't it? Go for it.
Okay, I'm gonna try. I don't know what Z
Okay.
is for, but I'm gonna try. E for e-health. My name is Izine. E for e-health. Z for I don't know. I for interoperability.
Okay.
N for network.
Okay.
Another N for I don't know. Then E for EMR. I tried.
EMR. Okay, good try. Good try, isn't it? Good try. Good try, isn't it? Good try, isn't it? Any other person who is up for this challenge? Any other person? We're all brilliant people in the room. The chat should be buzzing with our answers. I should be seeing lots of hands. Anyone? Millicent, do you want to try? Grace, do you want to try? Chidima, do you want to try? Chima, do you want to try? Dolapo, do you want to try? Grace, do you want to give this a try? Hafsat, Hannah, do you want to give this a try? Marvin, Michael, do you want to give this a try? You absolutely should give this a try. Any other person? Praise. Tinuade. Who wants to give this a try? Tommy, Sumbos, Winston, do you want to give this a try? Any other person who wants to give this a try? Where are we? Where are we? Where are we? Where are we? Where are the digital health experts? You need to know the keywords in your industry. All right. Grace, do you want to give this a try? I see you smiling in the chats. Grace, go for it. Give this a try, Grace. G for what, Grace? Grace, do you want to give this a try? Go for it, Grace. Okay, Hannah, H for health tech, A for advanced healthcare. Hannah, you are playing with the word healthcare, giving us different versions of the word healthcare. Another N for new age healthcare. Okay, N for network enabled healthcare. And Hannah is using us she's doing wire for us. Marvin, yes. Okay, Marvin, go for it. Marvin wants to give this a try. Marvin, go for it.
Marvin,
Yeah.
you're muted. I'm asking you to unmute so you can try. Marvin.
Good.
Okay, I can try one.
Yes.
Okay, I'm Marvin. M for medical innovation.
Lovely.
A for artificial intelligence.
Good.
R for remote care.
Lovely.
V for virtual reality.
So good.
I for integration.
Into what?
And then for integration. I for
Integration. Great.
integration.
Lovely. Yes.
And then for next generation solutions.
Next gen solution. So good. That was smooth. That was smooth. Lovely, 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 lovely. If I had a prize for this trivia, it definitely go to Marvin. That was so good. Well done, Marvin. Okay, if you didn't get to try the trivia, do give it a try during your free time. I'm sure you'll find it so fun. Okay, we see another one in the chat. Christian, C for content creation, H for health advocacy, R for remote patient care, I for innovative technology, S for social media engagement, okay? T for telehealth. Telehealth is already taken. I, okay. A, artificial intelligence, already taken. Give us another word. Oh, well done, Christian. Well done, everyone. Well done, innovators. Okay, now is the time we've been waiting for. Ladies, gentlemen, innovators, healthcare professionals, digital health enthusiasts. Now is the time we've been waiting for. The time of the rebrand. We have come a long way as the VC Health Tech Hub, doing phenomenal work in the digital health ecosystem across Africa, contributing to capacity development of digital health enthusiasts and professionals in Africa. Now we want to take it a notch higher. We want to be able to do deeper work, better work, accelerating impact on the continent, one country per time, right? So that together we can build the digital health ecosystem of our dreams across Africa, one that will translate to integrated, interconnected systems and ultimately transform lives, driving access to quality, affordable, and accessible healthcare. So, without further ado, I'd like to invite the dream team led by Ezine Onwekwe, to lead us in the unveiling of the new platform that will chart this new course of our time. Over to you, Tim. Over to you, Ezine.
Drum roll, everybody. This is a drum roll, drum roll, drum roll, drum roll, drum roll. I wish I had some music saying dun 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 dun. Anyway, thank you so much, Taiwo, for the introduction. So we're just going to go quickly to it. We've had a lovely conversation today, and this is us wrapping up and just telling you that this is us, the unveiling, as it's happening, and telling you that this is a new chapter, same old us, but a new name. Same mission, vision. Thank you, Tommy. Thank you, Charlotte, for the music and the drum roll in the chat. Thank you very much. These are very amazing cohort members. And so we are evolving or we have evolved after today, out with the old. The VC Health Tech Hub has been laid to rest as a name, and now we are called the Digital Health Skills for Africa. So in with the new. So that is our logo, and our name now is Digital Health Skills for Africa. So Africa, you see the African map, and then the cross usually stands for healthcare. And the DHSA stands for Digital Health Skills for Africa. And that is what we're going as our identity going forward. And this is us now introducing Digital Health Skills for Africa. And I'm doing this, not just me, but I have a team behind me, and also the board of trustees that we've been working together for the past couple of months, several months actually. And we have 6 members in a board of trustees. We have 4 staff members, and we have a couple of partners we've worked with when we were with us, the VC Health Tech Hub, and then we'll continue working with them as DHSA. So we are the digital slogan is Digital Health Literacy for Health System Innovation. Like I said, we are not just building digital health literacy for the sake of digital health literacy, but to innovate the health system, to build that innovation. And it's a community for bridging digital health system, for building digitally enabled healthcare workforce to drive health system innovation. Always digital literacy, health system innovation. This leads to the other one, and that's what we are going for. So our why is that we are closing the digital health tech skills gap. So we, like Dr. Esperance said, yes, it's unfortunate that our introduction to digital health is when you've graduated from school, which is very unfortunate. But why we advocate for that curriculum change, we want to do something. So there are a lot of organizations that help people. Right now, we've gone beyond people realizing that there's something called digital health. There's enough awareness about this thing called digital health. But right now, we're going to step further to, yes, there's a thing called digital health, and some people are already working in the space. So how do we further improve what they know? How do we foster that collaboration? So we're very heavy on collaboration, cross-country collaboration. So our sessions are why is to drive innovation by addressing critical gaps in digital health capacity and workforce development. We believe that technology can transform healthcare delivery and empowering healthcare professionals to become catalysts in this evolving landscape of digital health technology. How do we do that? Through collaboration, through other trainings. So these are a two-pronged approach. The collaborations that happen during the cohort-based trainings, during the boot camps, during the webinars. It's interactive, people exchange ideas, and from there, innovations happen. Then our vision is to build a digitally enabled healthcare workforce to drive health system innovation. And our mission is to build capacity of healthcare workers in digital health skills and to support organizational technology adoption for improved healthcare delivery. So most of our, about 70 to 80% of the people in our cohort are people who are already mid-career professionals who are already in the digital health space. And what we do is encourage them through improved capacity and also through collaboration to find solutions to problems where they are, to innovate where they are, to improve where they are through the things they're learning, through the collaborations, through the cross learning that is happening in the cohorts. And of course, we have other programs, which I'm going to talk about in a bit. Our core values are adaptability, definitely, impact, human technology synergy, and of course, collaboration is very important to us. So you can contact us. We're on all the social media platforms. Our website, our new website is up and running, DHSA Africa, dhsafrica.org. You can read about what we do, the programs we have, and you can reach out to us via email, hello@dhsafrica.org, or the Gmail accounts, and on LinkedIn, YouTube, and this is going to be uploaded on YouTube, this session today. So if you want to listen to Dr. Abimbola's presentation again, the panel session, all of that, this is going to be uploaded on YouTube later today or early tomorrow morning, and on Facebook. So those are the links to look out for. And on X and Instagram, we have that's our handle, so you can contact us. So thank you so much. We really truly appreciate your presence at this relaunch. This is not the end, but we thank you for this, and we still have a couple of announcements to make. But we thank you and encourage you to follow us on all our digital platforms. And if you've been following us on LinkedIn, we know that we bring out quality articles. We have a blog on our website that we're going to be bringing out beautiful articles. We have great writers in our organization, and we want to, one of our things that we offer is a repository of information. So through the blog, through a newsletter, through the social media platforms, you're going to get information, current information on digital health trends in Africa, capacity building, things you can learn about digital health happenings, or information on digital health in the African landscape. So thank you for that. And I want to say a big shout out to my team, the team that have been working together: Hannah, Rose, Tino Ade, the Pro Ali team, all the BOT Board of Trustee members that are on the call, and those who couldn't join, all of them. I want to say a big shout out to them because they've been part of this journey. It's not a me thing. It's a collaborative effort, and I sincerely appreciate the people who have rallied behind me to make sure that this is a success. The organization is a success. So thank you so much for this. And I'm going to play a video to just show how far we've come, and also as a way of saying, this is what we're about. And yep. And to say welcome to the new dispensation. I hope you can. Hello, my name is Ezinevisi Onwekwe. I am the founder and executive director of the VC Health Tech Hub, now Digital Health Skills for Africa. Our mission is to build the capacity of healthcare workers in Africa in digital health skills to drive digital health system innovation. We believe that digital transformation is key to improving health system delivery, and that is why we empower healthcare professionals to be at the forefront of this transformation.
And I feel so excited to have been selected as one of the participants in the second cohort of this training. While on this training, I've been exposed to other healthcare professionals across Africa, and also I've also had the opportunity to connect with seasoned professionals in the digital health space.
I've been always passionate about public health, especially leveraging technology to improve healthcare access and outcomes. Before joining the VC Health Tech Hub, I was eager to explore how AI could be used in disease diagnosis and empower underdeserved communities.
During the mentorship, I gained a lot of benefits, that is in terms of learning some technical skills, including data analysis, artificial intelligence, and also digital health systems. We also were able to gain a lot of understanding on how to position yourselves in terms of your career, how to revamp your CV to be able to get senior roles in your current organization or in other organizations, but also how to use social media and especially LinkedIn to market yourself in the domain of your career.
I joined the VC Tech Hub as a volunteer community manager for their latest cohort, that is the cohort 2. And that is because I had such an incredible experience as a participant in the first cohort. So I wanted to give back to this amazing community. Now I basically get to engage with members, organize fun activities, and ensure everyone attend classes while highlighting their importance to them. And we also dive into health-related discussions, making the community very vibrant and supportive.
Let me tell you something fascinating about Digital Health Skills for Africa. Digital Health Skills for Africa is shaping the way digital health skills is being applied to improve health outcomes for Africans. Through Digital Health Skills for Africa, a lot of health professionals are equipped with the right knowledge, with the right experience, with the right skill sets to transform and to make an impact in the healthcare ecosystem of Africa and beyond.
Allow me to introduce myself as a member of the Board of Trustees of the Digital Health Skills for Africa. We're a technology hub we have a very bold vision of raising the next generation of health technology leaders for the continent.
Today, I'm excited to extend my support to our partners, the VC Health Tech Hub, as they undergo a relaunching of their brand name. And I would like to mention that last year, 2024, that the Health Lity and the VC Health Tech Hub established a partnership to organize 2 successful webinars to mark the Global Digital Health Week. And we are looking forward to exploring more areas for collaboration.
Our goal is to ensure that these skills are used to improve the healthcare system and address challenges using digital solutions. Thank you for being part of this journey with us, and we hope you continue to be with us as we continue on this path. Thank you. Thank you very much. Over to you, Taiwo.
Right. Thank you, Izini, and congratulations to the team. This is indeed an auspicious one, and I am so delighted to be a part of this. I am so delighted to witness indeed our rebrand as Digital Health Skills for Africa. Yes, ladies and gentlemen, innovators in the room, thank you for coming on this journey with us. And together, we will build a digitally enabled workforce that continues to strive for health systems innovation in Africa. If you are not too busy, we'd like to encourage you to turn on your cameras. Can we take a group picture to commemorate today's event, today's auspicious relaunch? So please, if you could turn on your camera wherever you are, so that we could smile for the camera and take a picture. So we'll give everyone about a minute or two to turn on their cameras so we can see our lovely faces and have a group picture. And the DHSA team will take the click. All right. Do we need more time to turn on our cameras? I see a number of cameras being turned on already. Many thanks to you for turning on your camera. Waiting for others to join us in this camera taking activity. I mean, picture taking activity. All right. I see Michael, I see Patrick, I see Tubosun, I see Chima. Yeah. I see Grace. Okay. So is the DHSA team ready to take the picture? Just let me know if you are set on your end. Okay. Are we going to, I could do the count. Is any other person joining us? So I'll do a count, 3, 2, 1, and go. All right, and smile for the camera. All right, 3, 2, 1, and snap. Great. All right, thank you so much, everyone. This has indeed been a lovely, lovely conversation. I know that you've been energized. I know that you've been catalyzed to take action. ultimately, I hope that we'll take a step further to begin to implement the actionable insights that we have obtained from today's session. I will invite the DHSA team for any final announcements. I know we've got a few announcements, so we can have that announcement even as we then wrap up officially.
Okay, yeah, thank you everybody for joining us. I think in the chat, Tinuade has put all the links to our social media handles, and we want you to, I'm going to share my screen, and we want your feedback on this event. So please, the link on the screen, you can scan this or put the link and tell us how the event went for you. You're also going to get this in an email for all the people who registered or who attended. You're also going to see it on our social media platforms. So we have a couple of events. We have a cohort ongoing now, and I know people already asking me for when the call for the application for the next cohort is going to be. So it's going to be towards the end of March, beginning of April this year for the next cohort. And believe me, the testimonies from this cohort, when it starts coming out, already some of them are on the website. It's amazing. The experience has really been amazing. Another thing else that is going to happen is we have tailored boot camps. So we do a poll for what people want to learn for like a space of 4 or 5 weeks or 6 weeks. Actually, we usually do 6 weeks, and we'll do a boot camp on that. And this year we're thinking of cybersecurity for healthcare. Last year we did predictive analysis for healthcare. So this year might be on cybersecurity for healthcare. So just letting the cat out of the bag. And also we are starting a series because one of the questions which I answered today is, how do I get into digital health? How does someone who doesn't have a background, I'm a pharmacist, I don't have a background, I'm a nurse, I'm a doctor, but I want to get into digital health, I don't have a health informatics background, and how? So we're starting a series on YouTube, which is going to be a question and answer session, very informal, with people who have gotten into this space. We don't have a curriculum for digital health, but somehow we have people working 10, 11 years in digital health space. I'm an example of that. Dr. Esperance is an example of that. Dr. from Abimbola is an example of that. None of us study digital health as undergraduates or even postgraduates. So, but we are all in the digital health space. So we're going to have some of these people have a chat with them to find out how to get into that space. So it's a career showcase we're going to start doing on YouTube. We're going to start the month of February. It's going to be every month or every other month when we start, and then we start going every month. So that's something else to look out for. So please follow us on YouTube so that when it launches, you will be the first to know. So, and I also want to thank really our board of trustees. They've been here for the beginning to the end of this event. So I'm not going to call their names, but we're going to unveil them with time. Please follow us on social media platforms. We want to get your feedback on this survey. And thank you everybody for the time, for staying with us up till now. We had over 50 people in attendance, and many of you have stayed up to this point. It's supposed to be a 1 hour 45 minutes thing, but I know you've had a good time. And I just want to say thank you from the bottom of my heart, and happy Sunday, even though it's probably night for some of you. Happy Sunday and have a lovely week ahead. Team, is there anything else anybody has that I haven't mentioned? You can just put in the chat. I don't see anything else. Okay, thank you so much. So we look forward to hearing from you, from seeing you, follow us on social media, engaging with our content. So please, if you have any suggestions for us, you can always just via our email, which I had put up before. You can reach us via email. You can write to us. You can DM us on social media. Suggestions, if you want to partner with us, please be big on collaboration. For just in the space of 1 year, we've had almost 25 people. We've worked with almost 25 experts, and we have collaborated with about 4 organizations. So we're big on collaboration. So like I said, we can't do this alone. So please, collaborations are welcome. And thank you so much from the bottom of our hearts. I can overemphasize this. And please have a lovely day. So send the feedback via the emails and social media platforms. So we want to hear from you to see how well we did and how we can do better in the future in organizing these events. So thank you so much for your time and have a lovely, lovely week. I know this is January that does not end, but I think it's ending soon, next week or next 2 weeks. So enjoy and have a great time. So Taiwo, do you have anything else for us?
Yeah, nothing much. Thank you very much, Ezine, and congratulations once again. Thank you so much, everyone, for staying with us. I trust that you have had a super charged time with us. And yes, looking forward to seeing us all work together to bridge the gaps and bridge the divides towards creating a truly digitally enabled Africa that transforms lives, that impacts the healthcare sector for good. As we go, don't forget to follow Digital Health Skills for Africa, DHSA. Please follow us on all social media platforms, Instagram, LinkedIn, all social media platforms. And of course, let's connect also in the chat. So you can share your LinkedIn, the link to your LinkedIn profile, follow one another, build connections, and let's all grow together. Thank you so much, everyone. I remain Taiwo Olawemi, and it was a pleasure to be with you all today. Do take care.
All right. Bye.